I do get asked a lot for is yoga for bettering ailments. So I try to veer away from something being good or bad. I think if you label something a part of your body good or bad, you can slightly alienate yourself from it, almost giving it away to somebody to fix. I certainly have had that experience in my practice in sports massage, in that if somebody's got a bad shoulder or bad arm, then almost try to give you that part of the body. Slightly dissociating from it, in a way to dissociate from the pain and to deal with the pain, manage the pain. So I'm going to talk a little bit about what you could do to better your knees. Yoga is a practice where people might veer away from because they think they've got to put pressure through their knees or to move with their knees on the mat. And I think there isn't enough concentration sometimes on what could be done for that, especially if a class is fast or there's a lot of people in the class. So things that people can do to gain better control of the knees, because the knee is a joint which does have a lot of lubrication in the synovial fluid when people move. However, if for any reason that hasn't been able to happen through pain or inflammation, or certain parts of the structure within the knee have been worn away and there isn't that cushioning, it is then very difficult for people to trust the joint, but also to use the muscles that are around it. So the muscles that are around your knee, so the quad that supports the knee, the IT band which runs up the side, which you might hear about quite a lot as getting very tight, especially on runners. If it's too tight into the side or into the bottom of the IT band, which attaches into the knee, if it is too tight in that portion, what it will do is pull the knee out of alignment, which sounds quite gnarly really, in that it will pull the kneecap out of alignment, so that when you try and go forwards, like in a running style, it will take the knee too far towards that lateral side, to the outside of the leg, and you'll get incredible pain under the kneecap. So when people talk to me about knees, one of the primary things with sport is that that IT band is too tight and the kneecap comes out of alignment. So the way to get around that is to lengthen in the IT band, but also this part of your quad, which is called your vastus medialis, your VMO. It's about making that tighter to be able to bring the knee more into the center. So if this part is too tight, the lateral part is too tight, we're pulling towards the outside. If the medial side is tighter, it pulls more to the inside. Now you can get over tightness in your VMO, especially if you do a lot of cycling. So it's the kind of muscle you can fit if you're down pedaling, and when you're cycling, you can put your hand down and feel how tight or how solid that gets. It's like a pear drop shape on the inside. So a good way to engage that muscle is to use a block. And if you use a block in your yoga practice, what that then does is makes you use those muscles. So it makes you use the muscles on the inside of your legs, which are the vastus medialis, the adductors, so the inner thighs. And by doing that, it then engages the correct part of the body, rather than using these muscles to tighten and to get stronger and to veer out then to the outside. So you want things that bring in. So it would be things like, even if you were doing a vinyasa, so even if you were a vinyasa flow, even if you were doing the sun salutation, you would use the brick between your knees or between your thighs. So you would then encourage that engagement. Excuse me if I knock my head off. So you'd then encourage that engagement of the knees, of the inner thighs. You can have it however it fits. And when you're coming up to vinyasa, when you're moving through and stepping back, you're having to think about engaging those muscles. Even in downward dog, you would then be engaging those muscles, rather than engaging the muscles, say on the outside. Now, with a lot of knee issues, It then carries on up to the hips and you start to disengage the glutes. You get that a lot when people do a lot of running, because it's such a fast action that actually when you're moving too fast and not consciously, you then switch off the muscles around the glutes. It can then be a real issue for re-engagement. What this will do, using the block, especially in a downward dog, is start to re-engage those muscles again. So you can have it in your practice that you always use a block in most of the poses, especially anything with the legs in a straight line. So in Tadasana, when you're stood at the front of the mat, when you're moving through a vinyasa, especially when you're doing things like a chaturanga, so a press up to the floor, back into downward dog, you're always then hugging these muscles in and recruiting them. Other things you can use them in would be things like bridge. So in bridge, you're moving through the spine, articulating through the spine, bringing it off the mat. What you're also doing is then recruiting the glutes, recruiting the inner thighs, pressing into the brick. So you need to have your feet in the correct position. So you need to have your feet narrow enough to be able to do that. Without the block, the knees can be going all over the place. There's not that subtlety to the engagement that you get with using a block. Other things you can do is work on quad engagement with things like in a seated position, spine is long, you can bring the foot to the floor. So using that subtle engagement. It's quite tricky if you've got tight hip flexors. I have quite tight hip flexors, so even in a seated position I find that quite difficult. You might want to bring yourself up on something, be that a block or a cushion, whatever you've got around the house, blanket, and then use that subtle engagement, because it is quite difficult to lift that leg slowly and subtly off the floor. So you would take an exhale and an inhale, an exhale and inhaling off the floor. Staying there for 3 breaths. Inhale and exhale down. So even that, I can feel it ricocheting up my quad into the glute. So really firing those muscles, recruiting those muscles. Those muscles won't recruit if you're switching on bigger muscles away from it. And that's the essence of this more subtle work within yoga that you can do to protect your joints, especially if you've got any pain, any inflammation, or any tightness within them. So other things you can do standing poses with a block, and then we'll look at some stretching. So at the moment we're looking at anything that recruits those muscles, so anything stabilizing. So other things you can do is chair pose with a block. So you're coming down like this, so you're looking at stabilizing the knees together, having the feet in alignment. Or you can even work at doing squats, which you're then thinking about the alignment of your knees going forward, or doing one-legged squats, which then have that process. So one-legged squats then allow you to utilize the standing legs glute and to think about the tracking of the knees. It's also a very subtle way to allow that quad to switch on and to start using those muscles again. So for some people with knee pain or no flexibility in certain muscles, it's quite difficult to do this sort of traditional quad stretch, which would be, very difficult to get the knee into that flexion, but also even to get that hand to meet the foot. So you could do that with something like a strap, if that was accessible to you, by bringing the strap around the foot. You could even hold on to something and bringing the strap up and pushing the hip forward to gain stretch in the front of the quad. You can also do that in a lunge. Now, if you didn't want to blanket or bolster your knees, which a lot of people tell me is the most uncomfortable thing about having a knee problem, is you could come into this high lunge with your fingers down, and then by looking up, so breathing in and breathing out, you're then moving through the hip flexor, moving through the quad, stretching out the front of the quad. Or if you want to place the knee down, bolstering with blankets and providing that cushioning. So getting the knee used to being on the floor again, which I think if you're doing a lot of cat-cows and your knees are on the floor, then that's when the knees start to become a bit of an issue. So hopefully you found that useful. Thinking about the subtleties of engaging, the fact that you need strength and flexibility in the muscles around the joint, but also being aware of things that may cause discomfort and moving out of discomfort, distinguishing the difference between discomfort and pain. Thank you for listening.